Great question. So there are a couple of different types of reconstruction that are both single step and multi-step. For the most part, earlier stage patients are offered multi-step reconstruction, and that's because they have more time. And also a longer reconstruction process lends a better result, a more natural looking breast, rather than just stuffing an implant into somebody's skin that has just been removed in the metastatic setting. So my reconstruction I had a mastectomy in February, and I went through the expansion process all throughout chemotherapy. So we went from having about 50 cc's of fluid in that expander bag that I told you about earlier, and then add 50 cc's at a time. I've got a very narrow chest wall, so that fluid would actually push backwards in my chest, and I couldn't breathe. So I had to go in a couple of times and have that fluid removed because I just couldn't handle that pain. And that was a really tough thing for me because I was so anxious to get a normal looking breast. I wanted something to fill out my clothes, and I couldn't handle the pain. So we had to go super, super slow, and we eventually stopped expanding in July. At that point, I had options. I could either have those little tubes pulled, a little cut on my side, and pull those tubes out, and it would actually seal itself off, and I could have a saline implant. That would be a permanent implant if I so choose. Saline is very hard. It's almost like a coconut shell. So it was not something I wanted to live with. I wanted to get what we call an implant exchange surgery. So they exchange that saline implant for a silicone implant, which is not harmful. It doesn't give you cancer or anything like that. It's a lot softer and feels a lot more like a natural breast. So that's about a 6-7 month reconstruction process. That's pretty typical in the early stage environment. In the metastatic setting, when you can convince a doctor to do breast surgery, they typically always do single step reconstruction because they're not going to put you through 7 months of agony because it's really a quality of life issue in that respect. So they will actually go in and they will do immediate implant insertion. You don't have that muscle expanded, so you may have a little bit of contraction where that muscle is pulling back a little bit, and you're not going to have the symmetry that you would have had if you had gone through the expansion process. But they do offer both for different types of candidates, and typically the longer reconstruction methods lend a better result.